All right, so this is chapter 21, poisoning and overdose emergencies. Talk a little bit about poisoning. We're probably going to focus more on the overdose because that's really what we see a lot of. Okay.
Excellent.
Can somebody tell me the definition of a poison? Just a general. I see where you're going with that. It's a little easier than that, though. It's any substance that can harm the body would be the definition of a poison. Okay? Different types, common types of poisons could be medications. So if you take too much medication, you want to take medications not prescribed to you. Okay, they can be poisons. Petroleum products, drinking gasoline, things like that. I'm looking at you, Brenton. You ever siphon gas out of a truck or something and you get a mouthful? It is terrible.
I always drink clear hose because of that reason.
Yeah.
But just like the fumes, like.
Well, you're not supposed to inhale when you're siphoning. You're supposed to just suck.
You still get fumes in your mouth.
Okay, I'm just making sure you weren't inhaling. Okay, all right.
Yeah, after you swallow a mouthful though, the fumes aren't bad.
And then we go back to our kidney failure because you drank too much gasoline. All right, so again, petroleum products, cosmetics can be poison, pesticides, plants or food. These can all be technically poison. Certain kinds of food, certain berries that birds eat that we're not supposed to eat, those can be poisonous. Okay. Yeah, I have them all over my house, and I don't actually know what they are though. I've never been able to identify.
There's an app that does that.
Yeah, the birds eat them, but they're almost like currents. I don't know how you say it, currents, but they're not. So.
App to identify plants with. Yeah, but it's expensive. Oh, you just X out of the one they want you to pay. It works pretty good.
Yeah, I'll have to get that from you later. Identifying plants. All right. So effects of any kind of poison. The harm is based on the nature of the poison, the concentration of the poison. What is it? How much of it is there? Okay. What route? We'll talk about the different routes you could get poisoned. Your age, your health, your weight. The bigger you are, the harder it is for anything to get through your system, right? So you might be able to drink a wine cooler and be drunk, and you might be able to drink a 12-pack and be like, I'm not.
8 beers on that.
You could have said a beer, like that wine cooler, you made it sound like you were.
What? Well, I didn't mean it like that. I was just, you were the first two people I looked at. You're underage. That's what I'm saying. You smell a cap of the wine thing and you're drunk, right? Exactly. But the point is, it affects everybody a little bit differently. It depends on your age and health and all that kind of stuff. Okay? Can cause damage to the skin or suffocation. Different routes. We can ingest it. We can inhale it. We can absorb it into the skin, or it could be injected. Okay? Children may accidentally eat or drink a toxic substance. Adults often over-medicate themselves and deliberately take too many pills, take too much heroin if they're trying to kill themselves. It's not uncommon. Or accidentally overdose. Okay? But what are some ways that we can, so we go to an unresponsive person, we're suspecting an overdose, what are some things, and I know the automatic go-to is, oh, they just did a bunch of heroin, but if let's just say it's not heroin, something else. What can we do when we get there to try to figure out what they took or how many?
Look around. Look for pill bottles or beer cans.
Ask if somebody's there.
Look for residue on the table.
All of those things you can do.
Residue on the table.
All those things you can do, and like an indicator we can do. They have a bunch of pill bottles sitting there next to them. Look at the pill bottle. When was that prescribed to them? Was it today? And there's 90 pills in there, and now there's none? Okay, that can be an indicator. We do that quite frequently. We find pill bottles like that, where somebody's acting altered. We'll look right at those pill bottles and be like, dude, you got this. This was a 30 bottle of pills, and you got it yesterday. Like, no, I didn't take, and you got pinpoint pupils. Like, yeah, you probably did. Okay. Could it be a new medication? It's taken for the first time.
Yeah.
They just got a new medication, they have some kind of reaction to it? Sure, they could do that.
Accidental overdose.
Okay. So again, like the other section with the allergic reactions, what interventions have been done? Did we get there, whether it is a heroin overdose or just pills or whatever, what did they do before we got there? They're gonna be like, oh, we gave him Narcan. Same thing. How'd you give it? Where'd you give it? How much did you give? These people don't know. They have no idea. They give out Narcan kits.
I have Narcan in my car.
They give out IM Narcan to some of these people. We don't intramuscular.
I have,
So you give a shot.
I am, but we get I am.
Correct.
Amazing.
I have the nasal one.
Yeah. Yeah. We had an overdose. I forgot where it was, but they had a little kit there, and it had the needle, and it had. Now, to be fair, they're probably better with needles than I am. But we get there, and he's like, "I gave him Narcan." And I'm like, "Okay, how much did you give him?" Because usually when we think Narcan, we think this. This is a 4 milligram dose intranasal. No, he had a kit with a little bottle that he drew up Narcan, and he gave it IM. So I'm like, "All right, where did you inject it?" And the guy's laying on the ground. We're bagging him and stuff. He goes right there. He's like pointing at a vein in his leg. I'm like, first of all, that's an IM medication. It's not made to go in your vein.
Intramuscular.
So we don't know how much he got. How much did you give the guy? I don't know. I just kind of drew some up in there. Okay, well.
He could have killed him if he had a bubble or something in the freaking.
Well, again, they probably know more about needles than I do. Yeah, I mean, but if it's given IM and there's a bubble in there, probably okay. But if you get a bunch of, I got him on camera, so whatever he was doing, I got it.
He winked. It wasn't like
Yeah, but if there's a big bubble in there and you get it in the vein, I mean, yeah, that can cause an air embolism. But that's the least of our worries, I guess. So, but what did they do before we got there? We need to know these kinds of things. Like, well, you know, you'd be surprised how often we put them in the cold shower and they didn't wake up. You're like, well, no kidding. Cold shower's not going to wake them up.
Did you go on any of the ones where they put the
Ice in their pants?
Yes.
ice?
Yeah, what's up with that? Is that a new thing?
I don't know.
Like a month ago, I went to one.
Tell us about it.
Yeah, this girl had ice down her shirt and down her in the front of her pants.
Must be the trick.
It wasn't a trick because she was still unresponsive.
Well, it worked for the
cold
last
water
guy.
Can't help with that stuff, right?
I don't know. I mean,
I swear when we took
I kind of wondered if
when we
it's-
took our Narcan class, that lady definitely told us that.
not that I've ever heard of. I mean, and you know what? To be fair, if you're just barely overdosed and you're just kind of out of it, but you're not fully unresponsive, maybe it would help you become a little more alert. I really don't know. I've never heard that before.
I kind of
The-
have a feeling that it like slows down the reactions you have.
Yeah.
Like cooling your body temperature.
Slowing everything down.
Yeah, I don't know. I don't know about that. All right, so what interventions have been done? Estimate the patient's weight. Rate of onset is related to weight. So what does a person weigh? Are they a big person or a little person? Okay. Did they drink a gallon of gasoline or a cup? Okay. Yeah, whatever. Okay. How much and how big are they? Okay. What effects are they having? Nausea, vomiting, altered mental status. Are they having pain, diarrhea? Okay. We need to ask all these questions. All right, food poisoning, pretty common one. They will have GI-related issues, and it could be within hours or it could be even days after they ate something. Usually like up to 2 days. Like, yeah, I just ate at that new seafood place. Maybe you have food poisoning. Okay. Activated charcoal. We do not carry activated charcoal anymore.
That was on our freaking test.
What was the question?
I don't know. I remember being on there. Was it not on there?
Activated charcoal is not something we carry around anymore, but it is in your book. You will very unlikely you're going to have any state test questions, but just so you guys know what it is, it's powder in a little jar, and you pour some water in there and you shake it up into a slurry, and they drink it, and they can drink it for certain poisonings in that. The doctor would recommend it, and that was part of our protocols back like 10 plus years ago. We don't use activated charcoal anymore. It's not in our protocols.
Yeah, we give it to the kid that drank himself, literally toxic.
There you go. And they might still use that in the hospital setting, but we don't carry that anymore. Okay. All right, but we do not contact poison control. If, you know, they say, like, if drink the Drano, call poison control at 1-800 whatever. We call medical control, whatever our medical control is. Okay, we call them and say, hey, this kid drank a bottle of Drano, this much of it, he's unresponsive, they're going to want to know the condition, and they're going to do their research to try to tell you what to do. Or they're just going to say, just get down here in a hurry, and then we'll have something prepared. Okay? So we do not contact poison control, we contact medical control.
What should they tell you? Like, go to the hospital?
Probably. I really don't know. I've never called poison control. No, I haven't either.
Go to the hospital. Okay.
Yeah, they're like, oh,
That's what they say.
on our way.
Why did you drink that? Go to the hospital.
Yeah,
I just really wondering.
Here's what this is.
I'm not really sure.
I just want to call it now. No.
You should call it.
See if they give you any home concoctions.
Yeah.
When we go on break, I'll call.
Take some bleach and take some ammonia and mix them together and then drink it.
Gargle it and spit
And
it
you'll
out.
be COVID-free.
All right. Different kinds of inhaled poisons. Carbon monoxide, right? Pretty common one. Ammonia, chlorine gas, agricultural chemicals, pesticides. Carbon dioxide can be a poison. Carbon monoxide, I would argue, is more dangerous. Who can tell me what carbon monoxide is?
Exhaust.
Yeah.
Exhaust fumes.
The exhaust of
They come off a furnace, hot water things.
Any kind of fuel burning will produce some carbon monoxide. The biggest places we see it is in like malfunctioning furnaces and things like that, hot water tanks. That's when we see it in the home mostly, but really if you put a carbon monoxide detector up to your exhaust, that's producing a ton right there. Okay, but carbon monoxide poisoning, you know, if the carbon monoxide molecule binds to the receptors in your blood cell that blocks the oxygen. So the carbon monoxide gets stuck to the cells that the oxygen belongs in. So the oxygen now comes in and it can't get to your cells. So you're essentially suffocating from the inside for very serious carbon monoxide poisoning. And the only way to treat that, if it's that severe, is a hyperbaric chamber. And I think the closest one is Pittsburgh. I'm pretty sure, yeah, Pittsburgh. So they need to go to Pittsburgh if it's that bad. And our treatment will be high flow oxygen to try to flush some of that carbon monoxide out of their system, but it's probably not going to do you much of any good. Now you put a pulse oximeter on somebody that has CO poisoning, it's going to show 100%. It's going to be an inaccurate reading because those carbon monoxide molecules are going to show up on the SpO2. So carbon monoxide poisoning can be very, very serious. Okay. If you're called to a carbon monoxide alarm, you want to have your detector. You want to be prepared to be in an SCBA, those of you who are certified to do so. We have gone into houses before where you get up there with a meter and it starts going beep, 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 and the number is just climbing and climbing, and you back right out of there and you put your SCBA on to go back in, because you get high enough numbers, it can kill you. You take one breath of it and you're dead. It's that serious if the levels are that high. Most of the time they don't get that high, but it can happen with a severely malfunctioning appliance. Okay. Carbon monoxide we talked about. Smoke inhalation. Smoke inhalation can be another type of. There's all kinds of poisonous gases in smoke. Think about your structure fire. Think about all the things burning inside that house.
carcinogens.
All that cancer, right? All that black smoke, all the hydrocarbons, all the plastics, all the stuff is all just in this black smoke. In fact, in house fires, not to get on, away from EMS stuff, but that people usually die from the smoke inhalation before they die from the fire. When we have fatal fires, it's because they took a breath of that smoke. That high temp toxic gas just chews right through your lungs and you just die. And then you burn up. So I guess that's probably better, I would imagine. But I digress. Okay, what are some signs of smoke inhalation? I mean, they're pretty easy question for you.
Coughing.
Coughing, difficulty breathing. What else?
Them just coming out of a fire.
True.
City, smoky.
Look like soot around the mouth, nose, that kind of stuff. Okay. What about detergent? What do you guys know about detergent suicides?
Like the kids eating Tide Pods, is that what you're talking about?
Drinking bleach.
No, but that's a whole that's a good point too. Yeah, adults too. Yeah. No, we're referring to detergent suicides. There is a concoction that I actually don't know what the chemicals are, but they're household items. Probably ammonia and bleach are involved, something else. And if you mix that together in your,
Toilet cleaner and bath salts.
Is that what it is? Okay. So you mix these things together in a car and you breathe it in and you die. So people kill themselves this way. So that is a thing. So what we need to do is be aware of that. If we're responding to an unresponsive person in a car and you smell something a little funny, you might not want to just go over there and open that door and stick your head inside. Let's see what's going on with them. Okay? Things to think about. These people will, because it's an intentional suicide, they don't necessarily want to hurt us. They just want to die. Sometimes they'll leave a note on the window. Says, I'm dead on purpose. Be careful opening the door. That kind of stuff. So you're going up to a car, unresponsive person in a car, and you see a note, probably safe to just back away. All right? It is a thing. I've never actually heard of any around here. There might have been, but nothing that I've ever heard of. But it's easy enough to do.
What do you do?
You might have to get the hazmat team involved.
Yeah.
Probably be the safest bet. I mean, if nothing else, you got to put full PPE on, SCBA, the whole 9 before you open up that door. Yeah. But probably be best to get the hazmat team involved. I mean, the person's dead. You can see them through the window. They're not breathing. They're blue or purple or gray or whatever color. That is a case where we do not expect you to open the door and check for a pulse. If the note says, hey, I killed myself on purpose. All right, different powdered chemicals. Some factories you might go to, they get some kind of powder on them that's burning. It's not all that common, but if you do have somebody with a powder, like a chemical burn going on, you want to brush the powder off, copious amounts of water. And in the meantime, probably try to figure out what it is. Call the doctor, say, hey, I got this guy, he's running his hand underwater. He had some powder that was this, that, and the other. I don't want to stop flowing water. What do you want me to do? Okay, look for some direction like that. These are not very common things, but there are things you need to be aware of, okay? Injected poisons. Alcohol. Alcohol is a poison. Sorry. No more alcohol. No, but severe alcoholics who've been doing it, who are truly addicted and have been doing this a long time, when they stop drinking, what are some symptoms of alcohol withdrawal? I'm talking your serious alcoholics, not like you hung over the next day.
You don't want another drink.
Shakes is big. Sweating. It can cause seizures. If you've been drinking for a long time, every day for many, many years, the funny thing is that alcohol is the one drug, if you will, that you can die if you quit cold turkey. Whereas like heroin, they say, is like the worst thing to detox from and come off of. You can't die coming off of heroin, but you can die coming off of alcohol.
You see, that's why they left the liquor stores open.
Yeah.
Mm-hmm.
I mean,
It's essential.
Yep. Yeah. All right. Hypertension, these people, profuse sweating, seizures. All right. The shakes we're talking about there. High heart rate. All right. And then some different substances. All right. We have our uppers, our downers, our narcotics, our hallucinogens, and our volatile chemicals are the main categories of substances.
That's supposed to be like a Mac Miller song. Uppers and downers.
Uppers and downers and narcotics and hallucinogens. So I'll give you a few examples and some signs and symptoms of them, and then we are done. Okay? Uppers. What do you think uppers are? Give me an example of an upper.
Cocaine.
Cocaine. Yep. Cocaine, amphetamines, any kind of stimulant. Okay? Those are what we call uppers. They can be snorted, smoked. It could be injected. You guys ever see Breaking Bad? They smoke meth and you can snort it. I didn't know you could do that until I saw that show.
I would inject it. I've never heard of that.
Yeah, I don't really know much about that either. But yes, so you can snort it, you can smoke it, you can inject it. Okay, your signs are going to be excitement, restlessness, high heart rate, high respiration rate, sweating, hyperthermia. Stimulants will actually increase your body temperature. Okay, so we see a person kind of tweaking out.
Taking your clothes off, running around.
See, but then you start thinking about the excited delirium too, because we talked about that in the one class too recently, right? And usually it's preceded by cocaine use. So it could be the hyperthermia along with the stimulant that causes that. But anyway, so that's an upper. That's our uppers. Downers are central nervous system depressants.
Alcohol, Adderall would be a stimulant.
Adderall is a stimulant. Yep. Yep. They're central nervous system depressants. Alcohol would be a depressant. Yep. Barbiturates, roofies.
Ecstasy?
No. No. Ecstasy is under the hallucinogens. Yep. Yep. So we're going to see these people. GHB. Do you guys know what GHB is? I watched a documentary the other day about celebrities tripping. You guys see that on Netflix?
No.
They interview a bunch of different celebrities and they tell their, like, they took acid and they just took mushrooms and stuff and tell their stories of it. It's kind of interesting. But they were talking about GHB and I didn't know what it was. I don't know what it is. That's why I'm asking you guys if you know what GHB is. GHB is a downer, though. I can tell you that much.
Oh, yeah, I don't know. I have to call him.
Huh?
I know somebody, he'd know.
Yeah? Find out and then let me know on Monday. Okay, but these are downers, okay? And the signs are going to be sluggishness, poor coordination, low heart rate, low respirations. Okay, so it's the opposite, uppers, downers, right? That's easy enough to remember. Narcotics are used for pain relief. So those are when we think about our opiates. Okay, our Oxycontin, oxycodone, hydrocodone, heroin, morphine, codeine, all those things are narcotics. What? Fentanyl's in there too, yep. Yep.
It's a club drug. I can't say.
Do it into the microphone. Oh, you want me to read it? All right. It can treat narcolepsy. Gamma hydroxybutyrate. That's GHB. That is, okay, it's commonly referred to as a club drug or date rape drug. GHB is abused by teens and young adults at bars, parties, clubs, and raves. Often placed in alcoholic beverages. Interesting.
Pretty much, yeah.
Kind of sounds like that.
What celebrities was talking about that?
Oh, Sarah Silverman was interviewed. Carrie Fisher.
Which ones were they were doing that? Where are the ones?
I don't remember which one. It's a good documentary though. You should check it out. It's on Netflix. Yeah, it's interesting.
Watch what?
Educational.
Yeah, it's very educational. All right, then we have, so that was our narcotics, and then we have our hallucinogens, okay? This will be an intense state of excitement and distorted perception. That's our LSD, our PCP, our ecstasy, mushrooms are in there, yep. Okay, these people are going to have a rapid pulse, dilated pupils, flushed face, and they're seeing and hearing things. They're hallucinating. Why do they call them hallucinogens, right? Makes it easy for us. And then our volatile chemicals, like huffing paint. You ever seen somebody who huff paint? So they take a brown paper bag. I mean, it doesn't have to be a brown paper bag, I guess. It could be any color paper bag. You spray the spray paint in there, and then you put the bag up and you breathe it in a few times, and you just start tweaking out. And there was always like a ring of paint around their face from huffing the paint. You can huff gas.
I've done this before.
No, I have never done this. I've seen the aftermath of it. Huffing gas, you can huff the vapors off of gasoline. That's why I was saying you shouldn't inhale when you siphon the gas, because it'll mess you up, man.
The dust sprayers for keyboards.
Oh yeah, that's one too. Forgot about that.
What's that? Chemical?
I mean, that's just like, I don't even know what's in it.
They put a,
Yeah, I mean, there's some kind of propellant in there. Whipped cream, whippets, yep. What do you know about that? I know your mom.
what does that mean?
I'm just saying.
We have a lot of cans of whipped cream there.
Ah.
I get a lot of jokes about it.
That's funny. That's funny. All right, but these people, so they'll huff the paint or the gasoline or whatever it is. The initial rush can act like a depressant, like a CNS depressant, so it makes them feel like, whoa, dude. All right, dazed, disoriented, coma, numb feeling, and it can cause changes in your heart rhythm. There's your chapter 21.
So we're done already?
Yep. Yeah, I was shooting for 7:30. It worked perfect.